welcome to another episode of the Black Student Success Podcast, brought to you by InQuire Hire, where we seek insight and guidance from successful Black professionals. My name is Ashley Quire, and as always, thank you for tuning in with us. Joining me today is Dr. Ojo. She is a medical doctor, and we are going to go through her unique journey and all of the things she learned along the way. So first off, hello, Temi.
Hello.
Thank you. Of course. Thank you so much for taking the time out to, during this time of all times to talk with us.
For sure.
Of course. So we like to start off by giving you room to brag on yourself. Start off with that question. Who is Dr. Temi Ojo?
Well, I guess I first have to start off saying, a child of God. I'm a daughter, I'm a sister, a family member, an advocate for medicine equality, especially for my patients, and someone who just wants to normalize and build minority doctors in medicine. That's very much what I'm passionate about.
Woo, that is an intro. When I grow up, I'm going to be just like her. All right. So exactly what do you do as a family medicine resident, and how long does it take to become a medical doctor after high school?
Well, let's start from the beginning. So, after high school, 4 years, go to college for 4 years. And then ideally, if everything aligns right, you go to medical school for 4 years. That's a straightforward path. If for whatever reason you get knocked off that path, if you don't have a mentor to kind of help you guide this path, because it's not easy, like a lot of things are not at the forefront. You find out a lot of things late. Then there are other ways. So what I did was after I graduated college, I didn't have like a mentor. I didn't know what exactly I was doing. And so I did a post-baccalaureate program for medicine. And that basically allows you to take classes, science-related classes, medicine-related classes, in hopes of, gaining admission into a medical school. So that was an extra year for me. And then after that, I went into medical school. As far as medical school, that was 4 years. And then after that, you go into residency, which is, you're a doctor at that point, but you're still training. And that's the point I'm at right now, in family medicine, which is your general practitioner, primary care, the people you go see to get your shots, to go get your annual exam visits. As a resident, like I said, I'm learning. So we're going all over the hospital in different specialties. I rotate in surgery. I rotate in cardiology, pulmonology, just trying to gain all this knowledge. I see different patients from different area codes, different states, different parts of the world. And I'm learning, just learning how to practice medicine safely, smart, that's pretty much it.
Oh, wow. That is a crazy life that you have over there, right?
Oh, yeah.
Not for the faint of heart.
Definitely not.
Not at all. So I know Temi from a program we did before high school. And I don't want to give it away, but I feel like in my heart, this is something that she's wanted to do from birth. I don't know. That's the sense. So it's beautiful to see that she is successful in what she wanted to do and her passion from way back when. Speaking of way back when, let's get to your childhood. We're going to have a little therapy session if you want.
Of course.
For you.
Of course.
That's that psychology degree coming out. Let's put it to use here too. But let's talk about your childhood. Not everyone's family makeup looks the same.
Right.
Where were you born and raised? What did your family dynamic look like?
Mm-hmm. So I was actually born in Nigeria. I came to this country when I was 3 months old with my parents, mom and dad, and I grew up in Forest Park, Illinois, and I have a younger brother who's a year younger than me as well. My parents are divorced and have been divorced since I was a young age, so I lived in a two-family household, which was great. My dad lived down the street, literally, and my parents, they definitely supported me through everything. And my brother as well, like they are definitely my foundation, pushed me to do a lot of things. And my mother and my dad really forced that fact of just experiencing the world, traveling young, just going after every opportunity because, they were just like, knowledge is power. So you might as well know everything. So, yeah. I mean, my childhood was great. I loved it.
That's good. That's great. Perfect. No, that's good that you have that experience and that exposure early to travel. I like to brag on myself as well in that area. I had these two amazing aunts that didn't have children at the time, and they took us everywhere abroad. And if you can just travel even out of your neighborhood, out of your state, go on a road
Exactly.
trip.
Yeah.
I mean, these days, just look it up on the internet, honestly. You can take trips wherever you want to.
Especially now.
There you go. So if you can, just browse the internet, look around, and just have as much exposure as you can.
For sure.
You did mention that you were not born here. Did you feel different in any way? I mean, my husband's family's from Jamaica, and
cool.
he always talks about how it's different growing up in like a Jamaican household, and then the rest of the world is like, or outside the door is different. There are different rules inside than outside.
Yeah.
Did you feel that at all, growing up?
It's kind of twofold, right? Because I came here when I was 3 months. So it's like, basically, I was raised here, right?
Right.
But I mean, your parents are going to be who your parents are. And my parents are loving, they are fun, they let you experience whatever, but they don't play about those grades.
Oh, I hear you on that one.
At all. And I mean, I think that's like a typical parent household. And, still just wanting to keep the culture, the Nigerian culture in our house was important, and, never forget where you came from. But I would say, you would have to talk to someone who came here when they were like 16, 17. I think
I'm sure it's different.
They have like a way different experience. But for me, it was kind of seamless, I'd say. I don't know.
Good. And I also like that you talked about how you had that foundation with your family. And, even though they're divorced, you still had that strong support system, which I like to highlight. If you need to get into a program, if you're looking for one in your area, please hit us up. We will definitely connect you to where you need to be connected with and with whom. Just to have that sense of support, because I feel like that goes so long into your adult life. So great. I already touched on this before. I feel like Temi wanted to be a medical doctor since birth, like even maybe pre-birth.
Probably.
Because I feel like I know I've heard her say this when we were younger, that she wanted to be a doctor. And that's something that she wanted to pursue. But tell us for sure, when did you realize you wanted to become a medical doctor?
You know what? People always ask me this question, and I really, really don't know. I just know that one day, probably around the third or fourth grade, I just got this idea. I just say it's sent from God. I don't know. Maybe it was a calling. But I was like, I'm going to be a doctor. And I just kept telling people that. I didn't know where it came from. Like, my dad is an African dance choreographer. My mom, she works in social work. She runs a day school for people who have Down syndrome. So, like, there's no one really medical in my family, to say the least. I have an aunt who's a nurse. I met a lady in church who was a doctor. Maybe that's it. But it was an idea that kind of just entered my head, and it just stuck there. So
that's amazing.
Nothing prolific, but
Wow, that's insane. Because usually kids are like, oh, I want to be this, I want to be that. It changes every few months. Definitely did for me, which is great. And now I'm interviewing people who do.
Exactly. Perfect. I won't lie to you. When you tell people what you want, what you think you want to be, you have to be strong in it, because there's a lot of people who'd be like, do you really think you can do that? And I think that also forced me to really, dig my heels in, because like, do you think you could be a doctor? I'm like, yeah, why not? Why can't I be?
I can prove you wrong, right?
So that kind of made me even more steadfast, like, exactly, like, I'm just going to do what I got to do. So when I first got to my college, I was like, okay, I need a pre-med advisor. Everybody said that's what you need. So I go to her, and she's just like, don't think you're going to get in because you're Black. And I was just like, hold up, what?
Oh, wow.
Is that the first thing you say to someone? Are you kidding me? Like, and that from there on is just like where I was like, all right, I don't need you. I just have to navigate this on my own, which created issues, but I'd rather it be the way it was than deal with that, So
I love how determined you were. Like, even though that happened, you were still the questions. You're like, I'm going to prove everyone wrong. Yes, I don't need help. I will figure it out.
For sure.
And I think that's amazing that you were able to achieve that. That's awesome.
Thank you.
So take us on we talked about a little bit about this, but take us on your education journey. I think when talking to students, high school students, and they said they want to be pre-med, we kind of go through what that whole process looks like.
Right.
And if you, someone who's experienced this, can kind of break down your options all the way through, I guess, the part where, okay, so this might be a rumor from a student, but basically basically, the rumor was, depending on your grades, when you're trying to get into med school, depending on what they are, that kind of determines where you can go as far as your medical career. I guess, is that true? And I'll just let you speak on it because you're the expert.
Well, it's not a rumor. It's very true. Fact versus fiction, definitely a fact. But what I will say is more in the lines of it. I would say right at that moment, it determines what you're going to do, but it doesn't determine your like final outcome, right? So when you are in college, like I always say, if you can strive to be the best, like A's count always, high GPAs count, getting high scores in the MCAT, always training early, studying early. Like if you know that you need to take the MCAT your junior year, start looking at that stuff freshman year. It doesn't have to be like intensely, but the more you do, the more you learn and the more you know. But, and this is speaking to everybody at all levels, because I'm not just talking to high school students. If you're at the college level, if you're a senior and your grades are not looking the best, or you didn't have a pre-med counselor to tell you to take these specific classes and you have classes missing, there are other options. It's not medical school, never. It's medical school, not right now, because I got to get better. And so there are programs tailored to that. Like I spoke on before, post-baccalaureate programs specifically gearing to medical school. And so what that looks like is basically you apply to these programs. They can either be determined undergrad, where you can use undergrad loans, or some, depending on what school, it'll be like a grad school extension. So then you would be going into your grad school federal loans. And you take science classes, you take medical school classes. Sometimes it'll be at a college institution. Sometimes it will be at a medical school, and you will be taking classes with other medical students. The goal there is to get the highest grades that you can get. And then to take the MCAT if you haven't taken it already. Basically, you're optimizing your GPA, you're optimizing your resume. And then once you do that, most programs are a year or 2 years long. You come out on the good end, you do really well, you have a high MCAT score, then you're ready to apply to medical school. And I will say this now, like if you feel like you're not at your best when you're done with college, postbacks are not a bad idea, because you want to present yourself strong. You don't want to have to apply to medical school 3 times in a row, 3 years in a row. It's expensive. It's very expensive. And it can kind of play with your psyche too. And it's not that you're not good enough. You just got to make sure that your ducks are in a row when you do that. So there are definitely options out there. And I think that's one thing that pre-med people don't talk about, like these pre-med advisors. It's always like you need to go to college and go straight into med school. That's not true. There are other ways.
That's awesome. I had no idea that was an option to basically
Me neither until I had to do it.
See, this is information that would be helpful,
exactly.
Right? To know. And you kind of spoke on not knowing, anyone in the medical field growing up. And so having to find this out on your own.
Yeah.
Is tough. But thank you so much for sharing that to our listeners. I'm sure that would be really nice to hear that, if at first you don't succeed, try again. I mean, that definitely applies here. And I feel like that applies with any area, any career, right? If you don't get in the first time, grad school, we hear that, students don't get into their grad schools. It's not over. You have different options. And thank you so much for presenting that option of the post-baccalaureate program.
And can I just say, mentors are important, okay? So it doesn't have to be somebody at your school. We all go to church. We all have family members who have family members who got friends. Like if you find something that you're possibly interested in and you can find somebody to talk to about that, please do. As a kid, I was very determined, but I also was like not the greatest at networking, right? Like I didn't like talking to people. And so I think that also created barriers for me. And so when I mentor like younger people, I'm just like, listen, go out there, talk. If you want to be a doctor, a lot of people will let you come to their clinics and rotate with them and start seeing patients. Like these are valuable things. And so if you can get somebody to help steer you in the right direction, it's better than walking in the dark. I promise you.
No, for sure. If you can reach out. Now we have a bunch of professionals on our website right now that you can reach out to. Everyone has agreed that they will be a welcoming mentor.
Sure.
But in college, it was tough. I'm like, I don't even know what I'm doing. I feel like I'm not getting what I need from what I have at school. And so I remember actually finding this person on Google. I don't remember where I won't mention her name, but I don't remember where I found her, but I definitely had to find my own mentor, like you said. And we met at a local coffee shop on campus, and she mentored me for the rest of my college career because, like Temi said, like it's hard to stay on track if you don't have something to look forward to, right? Like if you're like, oh, I'm going to become a medical doctor, that's great, but you don't know what it looks like in its entirety, definitely reach out. Temi has agreed to share her contact information with us. Yes. And so if you reach out to us, we could definitely connect you with her. She's an amazing person, and she's very sweet. I remember that. All right. So during your journey in higher education and med school, how was your experience as a Black female?
If I had to, basically in a statement, I'd say it's empowering but challenging, right? So when you walk in the place, you are one of very few, and that's the empowering part, because it's like I did what I could and I made it, you know. But the challenging part is like you're always gonna have to prove yourself in one way or another, and that's with anything, not just medical school. You know, that's just in life, you know. But for me, I mean, I have very, very strong-willed parents, and they taught me a lot from when I was younger. So anything that somebody told me, anything that somebody did to me, I just brushed it off because I knew like the goal was, I just need to get this degree. Like I don't need the other nonsense that comes with whatever you have. You know, the problem is with them. It's not with you. But I won't lie. It's not easy, but it's definitely doable. There are definitely instances where you always have to defend yourself, whether it be from like a teacher, whether it be you walk into a patient's room and they give you that side eye. It's like, hello, how are you doing? I'm Dr. Ojo. How can I help you? And you kind of just establish that presence right there, and you do what you have to do. And you can't take everything to heart. Like, it is hurtful, but you just have to build on it. And that's what I want to tell my young people. Like, I have a lot of mentees who are just like spitfire. They're upset. They're this, they're that. I was like, use it. It's fuel. Like, that made you mad. Do what you need to do, because you're going to teach the next person. You're going to get the next person in, and you're going to teach them how to navigate that. So I would say just keep pushing.
Yeah, for sure. Use that as fire to, you know, accomplish your goal, right? For sure. Pick your battles.
Exactly.
At some point, I was the exact same way. I feel like maybe halfway through college, I'm just like, anything. How dare they say this? Stop asking questions about hair. Yeah. You know, you experience all of that depending on what school you go to.
Oh, God. All my patients are like, so what do you do with your hair? I'm just like, what is that? Why is that important? You know? And then you kind of have to look at it like, you know, I'd rather people ask me questions than to talk about me. And some people just genuinely want to know, like, they don't know a lot of Black people, especially in the professional field. And so I answer their questions proudly, like, this is what I do. So let's get back to these health problems, you know? And that's just what it is. So like I said, don't take everything as an offense. Like, some people genuinely want to know. And so just navigating that. Now, there are people who are offensive, and you professionally deal with them. Never step out of your character, because at the end of the day, when you get in trouble, you get in trouble, right? Mm-hmm, so you never want to put yourself in that position. But I would just say, whatever it is, just stand tall and stand right.
No, for sure. Walk in your integrity, answer their questions. Maybe they feel comfortable enough to ask you that question.
And yeah, exactly.
Mm-hmm. And keep it pushing, keep it moving. End goal, exactly. keep the end goal in mind, right? Exactly. Were you financially prepared for med school? That's a silly question to ask, because med school is expensive for anyone who did not know. College in general is expensive. However, med school, I mean, there are a lot more years that you have to get to your end goal, right? And so I guess, were you financially prepared? Did you get a heads up at all? What did you do?
So, I mean, everybody tells you that med school is expensive, but they never specify how expensive. And that's definitely something that I had to find out the hard way. I mean, I've been blessed, like, high school was paid for, college was paid for. So when I got to med school, like I didn't have, a crazy significant loan debt already. Like my credit was fine. And that's another thing I want to tell my young people. Do not mess up your credit, because when you go to grad school, these are all like, credit-based loans. And if you have bad credit, you're going to be in trouble. And that's when you go in a private loan world and you don't want to be there. So, I mean, medical school is expensive, and not just school itself. Like there's things you have to pay for. Like you have to pay for your exams that you have to take while you're, your board exams. Those can be $1,000, $2,000, just easy, just to take the test. You have to pay for the materials to study for the test. That can be another $2,000 in investment. And so for me, I mean, I don't know if I so much recommend this, but I had jobs when I was in medical school. And why I say I don't recommend this, because you are a student, like you are going to be studying 16 hours a day, easy. Like you sleep 8 if you can, and then you study 16, that's the 24-hour day. And I just kind of fit it in there to kind of, to work, because I didn't want to put that strain on my parents, and the loans that you get will help cover some things like rent and food and everything, but it gets really hard when you have to pay for all these things. So I would just say, going into medical school, just make sure your ducks are in a row. Make sure your credit's good. If you can work beforehand, make sure you stack money and have a savings account starting now. Savings accounts are important. But yeah, med school's not cheap, but it's not impossible. You work with your financial aid department. They help you figure out ways to get it paid, and you just do what you got to do.
Yes, reach out to the financial aid office as often as possible.
Please look for grants, look for scholarships.
Mm-hmm.
They're not easy to find, and also if your grades are right, I got a lot of grants based on that, and that's free money, that's not loan money. So that's another thing that you can do. But if you are I was best friends with the financial aid lady. I'll just be honest. I was like, listen, how can you help me? And if you ask for it, there's always hidden money. These institutions have money. You just have to ask for it. So
that is 1,000% correct. There is definitely money. There are discretionary funds, but I won't get into it. Yes, ask. Just keep asking. Be persistent, and becoming their friends is a good idea too. I used to hang out at my scholarship office all the time. Right after that, I think they're just tired of seeing my face. But persistence pays off. I'm just saying,
it really does.
If they see that you're serious, and this would help you, achieve that goal, and they believe in you, they will find a way to help you out. So
for sure.
All right. So what does a typical day of work look like for you? This is my favorite question, because this is where I get to be you for 5 seconds. So what does a typical day of work look like for you pre-COVID?
Pre-COVID, oh yeah, that's a thing now. So basically, depending on what rotation I'm on, whether I'm on surgery, whether I'm on inpatient medicine, where you're doing hospital medicine, anybody who comes into the hospital off the street through the emergency department, you have to take care of their care. I basically start my mornings probably waking up at 5:36, depending on the day, just to get to the hospital before 7. I see what patients I have. I review their cases, what happened overnight, what medications I have them on. And then I go see all my patients, and then I write all their notes. I make sure I coordinate with the different specialties. Like if my patient needs a gastroenterologist, I talk to them. If they need a surgeon, I talk to them, and just get their care. The basic goal is to get these patients back healthy, get them back home. And then, I'm also a student too, again. I'm basically trying to get a certificate in medical education. So I'm doing that as I'm doing my residency as well. And I'm doing mentoring programs with my mentor, where I'm talking to other younger people about medicine when I have free time. And so I'm busy.
When do you eat? When do you breathe?
I am not that great at that. I forget about myself sometimes, but honestly, I love what I do. I like to see my patients every day. I like when people get better. I'm in a field where I can literally talk to anyone from anywhere in the world, and gain all these experiences and then at the same time help people get better and optimize their care. So that's pretty much what my days kind of look like. Of course, spending time with family or friends, but yeah.
No, that's very rewarding. I say this all the time. If you do something that you love, it doesn't feel like work, right?
Yeah.
And so, as you like sigh, a deep sigh of relief.
Like, no, don't get me wrong. Like you know, you work hard in this field. And so there are days where I will do a 24-hour shift, or I will be doing a 12, 18-hour shift, and I'm just pooped, you know, and there are days where you get tired. But like I said, you remember what you went through to get here, remember what your end goal is at the end, and it kind of just pushes you forward. But yeah, you have to make sure you take care of yourself, because if you don't work, you can't work for your patients, right? And so,
it's so true. Self-care. Yeah. So what's one piece of advice you would give your childhood self? If you could go back and say, self, I don't know how old you are, or what the situation is, but if you can go back and say, self, don't do this, or self, I think you should, go in this direction. What would it be?
I would say put yourself out there more. Like I said, I did a lot as a kid. I had a lot of opportunities, but a lot of it, I was just like, oh, I don't know if I want to talk to this person and ask them to be my mentor, because I don't know if they want to do it, or I don't know if this and that. There's just so many self-inflicted questions and inquiries. I was like, just do it. You never know until you ask. If you ask somebody to be there for you or to guide you and they say no, well, ask the next person. Right? That would have saved me a lot of time, actually. Just putting yourself out there. There's nothing wrong with taking a chance. That's what I'll say. Just take the chance.
That's good advice. Take a chance on yourself. The worst they can say is no. It wasn't meant to be then, and move on. And I'm sure whoever decides that they or agrees with you to be your mentor, I'm sure they'll be way better than the other person, the first person that you asked. So
for sure. And I will say that not everybody you meet is going to be for you. So just be very vigilant about the people that you let in your life, in your circle, because they can lead you astray, and so you have to be very smart about who you tell your dreams to, who you decide to follow, because it's not, it's not the greatest out here, and you have to protect yourself and protect your dream and protect your mission. So I would just say, be very, very careful who you talk to.
No, yeah, for sure. I agree with that. Surround yourself with positivity.
Exactly.
Your uncle Frank has something negative to say every time you mention what your career is, maybe not mention that to Uncle Frank. Just talk about his cooking and say it's great. Just
no, for real. You don't owe anyone an explanation about why you want to do something, right? You just do it.
It's your calling. If you feel that that's a calling from the universe or from God, go with it. Don't, because no matter what, I feel like no matter what, he's going to still steer you on that path to whatever you were supposed to do in the first place. So if that's your calling, go for it.
For sure.
Do you have any last words for our students?
Yeah, I'd just say be intentional. Whatever it is you decide to do, make actual strides. Like, there's a lot of people with the shoulda, coulda, wouldas. And if I have to make it medicine specific, like applying to medical school is like a one and done deal for the year. So if you don't get yourself together by the time October, September comes, you're already putting yourself off a year, and that's not the same with other grad schools. Sometimes they have like two times a year enrollment, but medical school is pretty much that September, October deadline. And so if you don't have that, that's another year. And then the next year, if you don't have one thing, that's another year. This is how like people end up being 3-4 years out of school, which is also not a problem. If you want to take time in between college and medical school, that's great. But if that's not your plan, be intentional, know what you need to do and get it done.
No, I hear that. Don't waste time.
Yeah. Don't waste time. It's a very long path.
Yeah. Oh, goodness. And how much longer do you have until you're done with your residency?
Yeah, so to go off your other question before, so you got 4 years in med school. 4 years of college, 4 years of med school, and then depending on what residency you want to go into. So I chose family medicine. That's a 3-year program. If you want to do surgery, that's a 5-year program. So it just depends. For me, I am in at year 1.5. So I'm 1.5 years away from being a full-blown attending, and that's what I'm going to move towards and celebrate. So yeah, almost done. Almost done.
Awesome. We'll circle back with Dr. Ojo
Hey.
in the future in about 1.5 years when she's celebrating. So that's awesome. All right. Well, thank you so much for joining us today. And thank you all for listening. As a reminder, please don't forget to like, comment, share, and subscribe to the podcast. Until next time, peace.